The expert in brain physiology. His name is Dr. Matthew Borzage, talking about how it affects brain health, especially for Alzheimer's.
I like studying brain physiology because it's the element of brain health that underpins all of the brain function. We want our brains to have great memory and function, and what I study is the support system for all that, the blood vessels and the metabolism that allow your neurons in your brain to remain healthy and active.
So a lot of people think about Alzheimer's as a disease for only the older adults. What do you think? What's your take?
You could look at brain health across your lifespan. What's the earliest we could detect it? And potentially what's the earliest that we could intervene? But if we could find out early what's happening, then that might tell us more about when we should be intervening. Some of the vascular and metabolic insults to the brain might be happening earlier in life than we really appreciate. Unfortunately, patients get type 2 diabetes much earlier in their lives than they did previously. And we know that diabetes can be devastating to parts of your brain and your body that are highly vascular. And that's what our research focuses on, how we can study those vascular and metabolic attributes of the brain and understand if they're healthy or if they might need intervention.
So talking about Alzheimer's prevention and especially detection, could you speak more on your work with Dr. Hussein Yassine and Dr. Meredith Braskie?
The three of us have a really interesting research project. We're trying to look at the differences in brain health over time, and we're using the best techniques that we know to assess brain health in patients that have diabetes and may be at risk for developing Alzheimer's. And one of the things that I'm hoping we're going to find is whether or not the blood vessel and brain metabolism concerns that we have might be ways that we could better understand the progression of Alzheimer's.